Back in 1982, when thermography was brought to me, most people don't realize that it has been available since 1957 in this country, which means that it actually is a decade older than mammography. When it was brought to me, I thought, here we have a tool that is non-invasive, non-radiologic, there's no radiation, there's no compression of the breast. It's a completely safe tool that looks at the physiology of the breast. And as we all know, physiology always changes before anatomy. And I thought, well, this is marvelous because we have the opportunity to look at changes before a tumor in breast cancer will occur. So what a marvelous way to be proactive in our own health concerns. And so for the last 30 years, we've been talking about proactivity and trying to head things off before they happen. It is completely safe. You could, in theory, stand in front of a thermographic camera every day for the rest of your life and not have a problem. We can put children in front of the camera. You can put nursing mothers, pregnant women, anybody, because we're just taking the body's heat and creating an image. So it is completely and totally safe.
You cannot get to complete healing without healing the emotions. Yes, you can do all of those other things. You can eat as much broccoli as you want, but if there are emotional traumas that that have not been dealt with, that are not healed, you're not going to. It's not going to be a complete healing. That emotional trauma, the emotions are a huge component. Everything starts out in our energetic field, right? Before it manifests in the physical, it starts out in our energetic field. So that energetic field is where those emotions and traumas start. That has got to be healed. And when a person does that, that is the beautiful, beautiful opening of a whole new world of a spiritual life for them that it's just indescribable. 8 of our teeth are connected to our mammary glands. 8 of our teeth. So, and I have a tooth organ chart I'd be happy to send you, or you can look it up. All of our teeth are connected to other organs. So if you have an underlying infection, your body cannot clear an underlying infection in the mouth. The blood supply cannot get there to clean that up. You need intervention from a biological holistic dentist. That infection can go systemic. Even if it doesn't go systemic, it's a constant hit on your immune system. So if you've done everything and you're doing everything right, but you just can't figure out why your immune system is not performing properly, or you're having autoimmune problems, take a look at your dental health, right? It's connected to your whole body. There are in this country right now about 800,000 unnecessary biopsies done a year based on inconclusive mammographic studies. So women have dense breasts. That means that the mammogram cannot see through the density of the breast tissue. We have dense breasts until we're at least 50. I have women in their 70s that still have dense breasts, which means that a mammogram is going to be inconclusive due to breast density. There's actually a law here, just in New Jersey, or a national law that talks about breast density, and that they are supposed to say, due to breast density, the mammogram may be inconclusive.
One of the great reasons that women have breast biopsies are from microcalcifications. And the word micro, of course, means small, and some of these are millimeters in size. They're no bigger than a pencil point. When you look at the statistics, it suggests that 80% of all microcalcifications turn out to be benign. So women are getting biopsied with an 80% likelihood that it's going to be benign. And I have read at least one article that suggests that of the remaining 20%, 15% turn out to be cancers that never would have caused a death or an alteration in lifestyle. So we have this movement to biopsy all the microcalcifications when statistically there's 4 chances out of 5 they're going to be negative.